If you are already enrolled in Medicare, or if you're going to be in the near future, then you probably need to take a look at some of the additional Medicare plans that offer benefits beyond original Medicare Part A and Part B. These plans are split into three categories called Part C, or Medicare Advantage, Part D, and Medicare Supplement, also known as Medigap. In today's video, we're going to go over all three of these plan categories, what they cover, how much you could roughly expect to pay for each of these coverage types, and some pros and cons for each of these plan types, which you'll want to take into consideration when you're making a decision. By the way, I'm Sean with 65 Uncovered, and in my last video, I talked about some of the penalties that you can be charged if you don't sign up for creditable drug coverage when you first become eligible. So let's kick off today's video by talking about the simplest of these three plan types, which also satisfies this creditable drug coverage requirement. Part D of Medicare is a standalone prescription drug plan, which pretty simply just covers prescription drugs and not really anything else. These Part D plans are run by private insurance companies, which receive funding from Medicare, from CMS, to offer these plan options. Since these plans receive funding from the federal government, they're actually pretty affordable, with the average national premium for Medicare Part D being around $34.50 per month as of 2026. And because of the federal funding, you can actually find some plans which don't charge any premium at all beyond the original Part D premium. However, Medicare Part D does not cover anything medically, and the major disadvantage in signing up only for a Part D plan is that you're still subject to the standard original Medicare cost sharing. The issue here is that original Medicare does not put a cap on how much you have to pay out of pocket over the course of a given year. That means that if you have a really bad year and you have extremely high medical expenses, you can be out tens or hundreds of thousands of dollars depending on your medical situation. That's why most people who purchase a Part D plan will also sign up for a Medicare Supplement plan. Medicare Supplement, or Medigap, is our second type of plan that we're going to be going over today. And just like Part D, this is a plan that is run by private insurance companies. However, unlike Part D, Medicare Supplement does not receive any federal funding. Because of that, there is an additional premium attached to these plans, and we'll talk about what that looks like in just a second. The way Medicare Supplement plans work is they act as a secondary payer to original Medicare. This means that they cover a significant portion of the cost sharing that you are responsible for under original Medicare Part A and Part B. The federal government has standardized Medicare Supplement plans into 10 distinct plan types, each of which are assigned a letter between A through N. We don't have time in this video to go over all of these plans, but if you're interested in taking a look at that, we do have some free resources on 65 Uncovered where you can take a look at all 10 of these plans and see exactly what is covered under each one. In this video, we're just going to look at the most popular Medicare Supplement plan, which is Supplemental Plan G. Out of all the people who are new to Medicare and signing up for Medicare Supplement plans, over half sign up for Medicare Plan G. And as we go through the benefits, you might be able to see why. Plan G covers all of your cost sharing under Medicare Part A. This includes the hospital deductible. This includes all of your cost sharing whenever you go to the hospital, such as coinsurance or copays, as well as coinsurance and copays for skilled nursing facilities under Part A covered services. Likewise, for Part B, it covers almost all of the cost sharing for Part B services. The only thing that it doesn't cover is the $283 Part B standard deductible. And that $283 amount is as of 2026. That deductible changes from year to year. The bottom line is, if you sign up for a Plan G, then you rarely have to pay anything when you go to the doctor outside of that standard Part B premium. And as you might have noticed, that resolves the issue of not having a limit to your out-of-pocket expenses under original Medicare. Because as you go to the doctor or to the hospital under original Medicare, your out-of-pocket responsibility will almost entirely be covered by that Plan G, that Medicare Supplement plan. Now, as I mentioned, there is a premium attached to these plans, and as of 2026, the average national premium for Plan G is around $164 a month. And that's in addition to the standard Part B premium, which you're already paying, and any premium attached to your Part D plan. And you need to have the Part D plan if you do Medicare Supplement, because the Part D is what satisfies your creditable drug coverage requirement that Medicare requires from you. So you might be looking at all of these premiums and thinking, well, that's a lot of money that's going to be coming up front to pay for these premiums. And that's where I want to introduce you to our third and final plan type, Medicare Part C. Just like Part D and Medicare Supplement, Medicare Advantage is also run by private insurance companies. And just like Part D, Medicare Advantage plans also receive funding from the federal government. And similar to Part D, these insurance companies that run Medicare Advantage plans receive enough funding from the federal government that over 2/3 of Medicare Advantage plans do not charge any additional premium. Insurance companies that run Medicare Advantage plans have entered into a contract with CMS or Medicare, in which Medicare pays these insurance companies to administer Part A and Part B covered benefits. This means that private insurance is taking over for your Part A and Part B covered services instead of original Medicare paying for those services. In addition to running Medicare covered benefits, Medicare Advantage plans add additional supplementary benefits such as dental, vision, or hearing. Some plans also include gym memberships, and a handful of plans will even pay back a portion of your monthly Part B premium for you so that you don't have to pay as much for Medicare each month. And very importantly, most Medicare Advantage plans include a built-in Part D benefit, which covers your prescription drugs and satisfies that creditable drug coverage requirement from Medicare. And again, 2/3 of all Medicare Advantage plans don't charge you anything to sign up and get these extra benefits. But remember how I said that the private insurance company is taking over responsibility for the Part A and Part B original Medicare services? Well, because of this arrangement, the private insurance company actually has the right to impose its own rules on how you can receive care. And those rules can result in less flexibility, or at the very least, less convenience when it comes to receiving your medical care. These rules for Medicare Advantage plans will sometimes restrict you to only being able to see doctors within the insurance company's network, being required to get referrals before you can go see a specialist, and only being able to see doctors that are located within your plan's designated service area. Now, this is a good time to bring up an important distinction between two different groups that exist within Medicare Advantage plans. Almost all Medicare Advantage plans are either HMOs or PPOs. PPOs are much more flexible, and those three restrictions that I just mentioned either don't exist or exist to a much lesser extent if you sign up for a PPO plan. Referrals are typically not required if you have a PPO plan, and usually PPO plans will allow you to select doctors outside of your designated service area. This is especially relevant if you split time between two different locations. You're definitely going to want to get a PPO plan if you choose that Medicare Advantage is the right track for you. PPOs will also provide coverage to doctors who are outside of the company's network, but you will most likely have to pay a little bit extra if you go to a doctor outside of the network. Whereas if you stay within the network, you'll keep those costs down and have lower cost sharing. On the other hand, HMOs are much less flexible. These are the plans that are going to require you to get referrals. They're going to require you to have doctors within the plan service area. And most likely they are going to make it so that you can only see doctors within the insurance company's network. And finally, one other important benefit that Medicare Advantage plans add is a maximum out-of-pocket limit. Remember that original Medicare doesn't include any sort of limit on how much you have to pay out of pocket over the course of a year. Well, the way that Medicare Advantage resolves this issue is that they just put a cap on how much you will have to spend for Medicare covered services in a given year. The maximum out-of-pocket limit does change from plan to plan, so that's a very important thing to pay attention to when you're making your decisions. But as of 2026, the average maximum out-of-pocket limit for Medicare Advantage is right around $5,900. There's a lot that goes into these plans, and I have more videos in the works that are going to be coming out to do a deep dive into Medicare Advantage, as well as Medicare Supplement and Part D. But I'm going to do something right now that I generally hate doing, which is to oversimplify. You can view these 3 Medicare plan options as being divided into 2 distinct tracks. Track 1 is where you keep original Medicare Part A and Part B, you have Medicare Supplement, and you add a Part D plan. Track 2 is Medicare Advantage. And basically the trade-off here is price versus flexibility. In Track 1, you're paying significantly more in monthly premiums because you have to pay for Medicare Part B, you have to pay for that Medicare Supplement, and potentially for that Part D plan. But you maintain high flexibility and autonomy when it comes to managing your own healthcare. Track 2 is the much more economical route, where basically you're only going to be paying for the Medicare Part B standard premium, and then everything else is just bundled up into Medicare Advantage. However, like we already discussed, for a lot of plans, this can lead to decreased flexibility, which can cause some confusion or at the very least, some inconvenience. So which of these 2 tracks is actually the better option? Well, it depends. It depends on your personal situation and your personal preferences. If I can drive one thing home, it is that there is no such thing as a one-size-fits-all plan. If there was, then we would only have one type of Medicare plan. But instead, we have 3 distinct categories, and each of these categories has its own level of complexity. And this is really evidence that choosing the right Medicare plan is an individual decision. You have to weigh your own preferences, you have to weigh your own situation to make the decision that's going to be best for you. Well, if you're feeling a little bit confused or you feel like you need some help on this, I would recommend reaching out to an independent Medicare agent who can help you. Medicare agents don't charge you anything for their services. In fact, CMS has made it illegal for them to do so. So you can reach out to any independent agent, they won't charge you anything, and they can share insights and expertise on the Medicare system. And be sure to subscribe to our channel because in our next video, I'm going to put myself out of a job by showing you how to compare and choose Medicare Advantage plans without a Medicare agent, only using the tools that are available on Medicare.gov. And with all of that said, thank you so much for watching, and I'll see you in the next one.